Welcome to the ICU podcast, where we explore the vestibular experience through conversations between patients and the health professionals who care for them.
During this podcast, we invite patients to share their stories and healthcare professionals to ask questions so they are equipped to better care for and truly see the invisible challenges faced by their patients. I'm Kimberly Warner.
And I'm Cynthia Ryan, and we are your hosts on this journey of discovery.
Oh boy, this is going to be an episode for everyone because we all sleep. And boy, is it crucial. Somewhat overlooked maybe when we think about our vestibular stories, but sleep is essential. And if you're dealing with a vestibular dysfunction, getting high quality sleep isn't just a nice to have, it's an absolute vital part of healing. When you're well rested, your body is better equipped to handle treatment and manage symptoms. And on the flip side, sleep deprivation can actually trigger or worsen dizziness, imbalance, and other vestibular issues. In this episode, we'll explore how developing strong sleep habits, from setting a consistent bedtime to managing light and noise in your room, can become a powerful tool in your recovery toolkit. So grab a cozy blanket and let's talk about why it's time to take a nap. Actually, let's take sleep seriously and take a nap. I'm really excited to introduce you to our guests today. Tiffany Kopp, actually, welcome. Hello.
Thank you.
In June 2021, Tiffany woke up to her world spinning. I think a lot of us know what that's like. It took 2 weeks for her to be diagnosed with BPPV, 2 months to be diagnosed with vestibular migraine, and a month later, she was also diagnosed with PPPD. It took almost 6 months to find a doctor who prescribed a treatment plan that worked for her. She discovered Vita's website early on in her search for answers to her symptoms and then connected with several Vita ambassadors who helped her during her vestibular journey. So now she hopes that she can do the same for someone else. She volunteers as a Vita ambassador and believes that advocating is the best way to get the word out and help make vestibular visible. Welcome, Tiffany.
Thanks for having me.
Welcome, Tiffany. And I get to introduce Nicole Acerra, who earned her psychology and physiotherapy degrees at Queen's University. After working as a neurological physiotherapist in Canada, the United States, and Australia, she completed doctorate studies in neuroplasticity at the University of Queensland and postdoctoral studies at the University of British Columbia. She has 25 years clinical experience in neurological and vestibular physiotherapy in acute and private practice. She enjoys working closely with patients and families to develop customized treatment plans, which may include hands-on therapy, home-based exercises, management techniques, and coping skills. When not at work, Nicole enjoys spending time with her family and friends road cycling, skiing, hiking, gardening, traveling, reading, and doing yoga. All wonderful things that you can do in Canada. Welcome, Nicole.
Thanks for having me.
So let's just jump right in like we always do. Let's begin with you, Tiffany. And I hope you can't hear my cat meowing at the door, but he brought his toy down just a second ago. And so he might join you, Tiffany. But we would love to hear you describe the onset of your vestibular journey and then include in there how your sleep patterns changed after developing these symptoms.
Okay. So my symptoms started in June of 2021, and I was 9 months postpartum after my first child. And I remember it was like 4 a.m. in the morning, and I woke up and I went to roll over, and I had a hard time rolling over. But when I finally got over, just the room started spinning. So I had gone to the doctor and they didn't really know what was going on. And then I finally, a couple weeks later, made it to an ENT and they diagnosed me with, BPPV, which I had already been researching online and knew that was coming. And so, I went to the VRT and they corrected that. And I actually had it bilaterally. So I had to go for a couple of visits. And from there, it was just like I wasn't getting better, and I just was feeling so dizzy, and it was just getting worse over time. And I began having the problem sleeping, and I couldn't even sleep in like the bed with my husband because like the movement for him would just like it would just like set me off. And then it just like I couldn't sleep because I was just like, oh my gosh, he's gonna move, and that dizziness, and it just worsens. So I would like sleep on the couch, and as time went on, it just got worse and worse and worse. And then I finally had some vestibular testing done, and then 2 months later I was diagnosed with a vestibular migraine. And so I finally found a doctor that kind of specializes in vestibular migraine, and started some medications. Um, and then I continued doing like the optokinetics program through the vestibular testing center. And I just was not getting any better. It was just making my symptoms worse and worse. And I was just sleeping just awful. It was some nights I would get like 2 to 3 hours of sleep. And I would sleep in our spare bedroom because it was just like I couldn't fall asleep, and I didn't want to like interrupt my husband tossing and turning, and it was just awful. Um like I have never experienced insomnia until my vestibular symptoms began. But I mean, as time went on and I started like a treatment plan, things slowly began to get better. I even did like I had my ENT do a referral to like a sleep doctor. I was going to do a sleep study, and so I was waiting on that. But then all of a sudden, my sleep started like the amount of hours I was sleeping started to increase. So instead of like 2 or 3 a night, it would be like 5 or 6. So I think getting on the medications kind of was treating some of those symptoms and helping the insomnia. So it just kind of started slowly getting better.
Wow, it sounds like you had this like perfect storm. You've got you're 9 months postpartum. You probably weren't getting very good sleep to begin with getting up for your baby,
Mm-hmm.
and going through these hormonal changes, and then this vestibular thing hits. That just I can't even imagine the
Yeah.
brain fog you must have had walking around on 2 hours of sleep on an ongoing basis.
Yeah. And not to mention the panic and the anxiety every time you're like, I'm not going to sleep again tonight. And
Yeah,
oh,
I really don't know how I was functioning at all on 2 to 3 hours of
yeah.
sleep because like I worked full time too. So, I'm taking care of a 9 month old, and then, um, I'm working full time, and I don't even know how I was able to continue working, with as bad as my symptoms were. I just had to like push through.
Mhm.
And I work at a computer 8 hours a day, and it was just
Oh,
really, really, really hard.
it's brutal.
And luckily, like at the time, COVID was 2020 and still going into 2021. So like when things hit, we were still working from home. I mean, I still do now. I occasionally go to my office, but it was nice that I was working from home because I think had I worked in an office setting, I would have had to have taken leave from my job. I don't think I could have done it.
All right. Well, I want to pivot, and I want to talk to you, Nicole, about what does poor sleep, or how does poor sleep impact vestibular rehabilitation outcomes? Because Tiffany was saying that, she was getting poor sleep and her vestibular rehabilitation wasn't working very well. And I'm wondering if the two are connected.
Yeah, absolutely. I mean, I think the tricky thing just from the get-go is that sleep problems are really kind of unique for the person. The reasons why, like the blend of reasons, the things that are contributing to poor sleep can vary person to person. So there's no one piece of advice that would work for everyone. But what I can definitely say is I've done quite a bit of research in other populations, for example, the stroke community, where we know they've had a neurological deficit. And then what we do is we do studies where we get them to learn a task. And for some people, we interrupt their sleep. And for others, we don't. And we know that learning is slowed down if you don't sleep well. I mean, I guess we can see that in kids in school and stuff too. If they're not sleeping well, they're just not picking up on stuff. So I think rehabilitation can be sort of a little bit, it doesn't mean that it won't happen, but it could be a little delayed or maybe just take a bit longer. That can have an emotional burden and be frustrating and time consuming and expensive and impact like life and work, like Tiffany was describing. The other thing is it can also give you a false sense that you're worse than you are. So if you have one vestibular disorder, and then it's static, let's say it's not changing. Let's say you've had an inner ear infection or something like that. If you don't sleep well, you don't perform as well the next day. And this is, again, the same as kids or other people. I mean, your kids are never going to do as well on a test at school if they didn't sleep as well. It doesn't mean they don't know their math, but they just weren't firing on all cylinders, if you will. So I think it can also be confusing, because if someone's got this new diagnosis, they don't always know whether they're in a medically stable place where they're building week by week and slowly recovering from a vestibular issue, or like how does that mix in with a sleep problem. So it can get really confusing. Is this a new medical problem? Am I worse than I think I am? Or is my sleep making me appear worse than I am? Now, those are some of the things that can really impact things. Yeah.
So
I
it
think
sounds
that's
like
that's
you have to address the lifestyle issues before you actually go into therapy, or before therapy is going to be effective. Sleep and anything else that could be impacting your ability to react to the therapy.
well, and I also think, Nicole, what you said about it being person specific, that is a really important factor. I noticed when my vestibular system kind of went awry, I also was having thyroid issues, and I've had hyperthyroidism since I was in my early 20s, but I thought it had been managed. So what I even noticed to this very day, when my sleep, it's almost like clockwork. When I start to wake up at 4 a.m. and have that like cortisol jump, it's because I need more thyroid medication. I need to adjust my thyroid medication. And as soon as I do, I sleep right through that 4 a.m. wake up. So for me, there's a vestibular thyroid sleep connection. So, and I'm not saying that's for everybody, but everybody's got to probably find out what those little
Yeah,
links
and I
are.
think actually back to your point, Cynthia, about like which one do you do first? It's really challenging because people only have so much like time and energy to actually like attend rehab, for example. And I don't even know if it has to be an either or. Often I find it both can work well together. So I try to think of it as kind of big pillars. So when I see a patient, I need to know, of course, what their symptoms are and their goals are. But oftentimes I'm also thinking, okay, what lifestyle changes are doable that they could look at? And that would involve sleep. Of course, it involves things like eating and exercise and other elements too, but the lifestyle bucket, if you will. And then I look at the bucket of strategies. So, are certain strategies, if your balance is off, are you looking at walking aids? If your vision is off, are you looking at strategies for how to use computers or different things, which you've talked about in some of your other sessions with people? And then the next category is the rehab piece, where you're actually addressing your tolerance to stimuli, your ability to do certain tasks with your eyes, the gaze stability, and the eye saccades and jumping and other things. So the rehab is where you're trying to push the boundaries and grow your skills. And so, even though, again, I mean, if you think of your kids, they would have the same kind of idea. They would have drills that they would work on, or piano or music or whatever. They would have drills that they do. But if their lifestyle isn't in a good place, where they've got some good stress management, they've got some that kind of stuff in place, they've got the structure to their day and the little tools that they need to get through their day, it's really hard to move forward with the rehab. It doesn't mean you can't, but you just should be maybe a little more patient or kind with yourself, that it's tough. It's hard to get the track.
There's so
So
many
let
parts to the wellness. There's the
yeah,
sleep, you were talking about, the
yeah,
exercise, and they all impact each
Yeah.
other. It's like they're all
yeah.
wrapped together. You can't just address one. You have to look at them all.
Tiffany, you have a 14-month-old at home and a 4-year-old, you said. So I imagine your lifestyle is a little bit difficult to manage.
Yeah.
How is that affecting your sleep? And are you noticing a connection between poor sleep and your vestibular symptoms?
So yes, most definitely. So yeah, last year when I had my second child, like I had been off all my meds, and then it was in like that first month I kind of noticed, like, with the getting up and the down and the taking care of the baby, and it was like rough the next day. And I finally was to a point that I was like, I probably should get back on some medication. So I did. And with a 4-year-old, they're sick in the middle of the night, you're up taking care of them, and then going back to sleep, that's hard. And then you feel worse the next day. So yes, I mean, sleep is a huge factor, because sometimes I notice it's like every time that I don't have good sleep, that I'll have like an attack or a flare up, the next day. So,
Mhm.
um, and yeah, even, so like all that happened like last year after I had my baby, and then very strange, but it was strange because like my symptoms first started 9 months postpartum with my daughter. And then the end of this last year, I was 9 months postpartum with my son, and I had another flare up in vestibular migraine and triple PD. So now I'm,
Wow.
playing with medications and whatnot, with that, and working on the sleep thing again.
It's interesting too. You made me remember someone I spoke with on Instagram. This was a couple years ago, but we related on this that it's often also not just about lack of sleep, but he would say that too much sleep could also cause vestibular symptoms. So getting that extra hour, it's like, oh, I really want to sleep in on the weekend. And then sometimes that would increase like the vestibular migraine symptoms. So it's really interesting that sometimes we're not necessarily always talking about lack of sleep, but maybe more of what you're addressing, Nicole, as the whole lifestyle of the behavior of the sleep itself.
Well, so Nicole, that's a great segue to talk about what are some of the common sleep related challenges that your vestibular patients report, and how do you address them in your practice?
Yeah, that's a good.
More lack of sleep?
Yeah. So that's a great question. And again, I do have to go back to how unique it is person to person, which is not a problem. The challenge is it's kind of like a research study you're doing with a study N equals one person. That's the size of the study, one person at a time. So I think that one of the most important things is to start by capturing a little bit about where your starting point is, thinking back to kind of the person you were before. I mean, there's sort of like colloquial terms, like you're kind of a morning lark or kind of a midday dove kind of person, or a night owl. So there's kind of a personality kind of before you even get your vestibular disorder. There's kind of, we have certain traits about us anyway. And there's certain life factors that we can't always change, like you might be a shift worker or whatever. So there's certain things about who we are before we even get our vestibular disorder. But then also just kind of looking at the first point would be, okay, what are the challenges? Is it the trouble is, say, for example, falling asleep? Or is it staying asleep overnight? Or is it if you get woken up for some reason, do you have trouble falling back asleep? Or do you sleep enough hours, but you don't feel rested? So is it a quantity, a quality problem? And then I think that's kind of a little starting point. There are some good kind of free online kind of almost like assessment tools, I guess you could use, that could be really helpful for people to start if they're trying to unpack like what is my situation and how do I deal with this. There's like lots of like sleep inventory questionnaire type things that they could download for free and just see like, well, what are these sleep clinics asking of people, and see for yourself, at least start kind of understanding, getting a bit of a diary. Diary is a tricky one.
Mm.
Just as a little aside, sometimes people get a little anxious or flustered when they make a diary. Like it can cause a certain level of anxiety. So without looking at themes, humans are not doctors. We don't always make sense. So, you know, 1 + 1 does not always equal 2 in a human. So sometimes you can do everything right and you still won't sleep ill that one night. Other times you've broken some rules and you get away with it. So you kind of have to be a little bit, see the forest through the trees, look for themes, and see what in general what's happening. I think that's a good starting point. A lot more, I guess, I can say about the details and how to kind of unpack it afterwards, but that's a good starting point. Assess where you are, get a sense for what you think who you were before, and like if there's a mismatch there. Some people will just say, I think I'm sleeping the same amount, but maybe I need more sleep than usual because my brain is recovering. And other people say that no, the vestibular disorder is causing me different kinds of, like, for example, I'm anxious to turn in bed. So I don't sleep because I'm worried I'm going to roll over and get my symptoms. So sometimes it's truly new and attached to the new dysfunction or challenges or symptoms you're experiencing. Yeah.
Nicole, do you have, and it's okay if you don't right now, but do you offhand have any of the favorite link for one of those sleep surveys that people might?
Well, I don't have, I can try to give you a couple of them. I know there's a Pittsburgh sleep scale. There's a few different, like sleep disorders questionnaires. There's a few of them that are out there. There's probably about 30 that have been researched. So there's quite a few of them, and some people
Okay.
have preferences of one over another. I have a couple that I kind of use that are just a bit easier, like easier to answer and give me a bit of a picture. For a bit more on the some of these studies, some of these questionnaires are also like to look at if it's more on the emotional, anxious side, or if it's more like the sleep disruptions, like sleep apnea, like I'm not sleeping through the night because of that, or if it's frequent urination or something, then they might be like, oh, is there a prostate problem, or is there a or maybe women are going through a period of life of menopause and they're disrupted in their ways, or, there's a number of different kind of ways of unpacking it. So even within, I use different assessment tools for different people. I don't have one that's the standard. I kind of listen to their first story, and then I kind of pull out the one that I think kind of mirrors what I get the sense the picture is, to get a starting point.
We can put those in the description, the podcast description.
Yeah. If you send us a few of the ones that you use with your patients. So, Tiffany, I'd love to hear your sleep strategies as you're working through having toddlers and babies at home and all of that. I'm still imagining you're probably finding some tools to help you with your sleep.
Yeah. So I remember when all this first started, I couldn't do like any kind of light shining in the room. So like we have a TV on our TV stand, and there's a blue, like when the TV's off, there's a blue light. And I just couldn't have any kind of light coming from anywhere. And then on the baby monitor, the light shining off of that, I could not have that. So I had to like turn off all the lights and just like block all the lights. That's gotten better, but like blackout curtains in the room is a lifesaver. I will sometimes use earplugs, especially if we are traveling, and my family's all in the same hotel room, just to like block out some of that noise from like the kids and like outside noise. When symptoms started, I would use melatonin for a while. Once sleep got better, though, I quit taking that because I didn't want to get that I was relying on it every single night. When I was pregnant the second time around, I would take the Unisom, like a half a tablet, and that helped, especially like with the third trimester. You're already not sleeping well, and that helped. I do take magnesium every day in the evening, and so that helps with sleeping through the night. I'd say that's the majority of my tools that I use. I do try to go to bed around the same time every night, like within the same hour. Of course, that's not always doable, like on a weekend if you've got something going on, but during the week, with our work hours and whatnot, it's pretty much the same bedtime every night, and then waking up the same time. And of course, I have kids, so there is no sleeping in. So I'm up at the same time pretty much every morning, including on weekends, no matter how late I stay up.
I love this discussion because there are, as you said, Nicole, everybody is different. There are so many little tips and tricks that work for some people and not for others. I mean, for myself, I like you said, Tiffany, blackout curtains are a must. And I've stopped. We used to have one of those clocks that lit up in the dark in our bedroom, and I just, I don't use that anymore because I don't want those kinds of lights. Some people use a sleep mask to block out all of those lights, especially if you're sleeping with someone who does want some light, or you want some night lights so that you could, because some people who have like bilateral vestibular loss literally don't know which way is up if it's totally dark. So if you have night lights to get to the bathroom, using a sleep mask. I sleep with an air purifier on for the white noise, and I know there are other people use actual white noise machines to create white noise.
That was something I didn't mention, was the white noise.
Right. And I think I'm fortunate in that my bedroom is actually in underground in the basement, which minimizes the noise coming from outside the house. So lots of ways to minimize noise like that. How about you, Kimberly? Do you have any other tips?
I have one that I'm excited to share because it's kind of remarkable, and I was doubtful when I started it. And this is for those that may have a little of MCAS, which is mast cell activation syndrome. Wasn't demonstrating allergies. I've never had allergies in my entire life. So I never thought that like I had any sort of histamine response. But my naturopath, who is a genius, and has been helping me from day one with the vestibular stuff. Because of the autoimmune stuff that I deal with, she said, I'm curious if you're having histamine release from your brain in the night. And that is a thing. And she said, try taking, because she does with some of her patients, a Zyrtec, just an over-the-counter Zyrtec at bedtime. Or I usually take it like around 8:00, and I go to bed at 9 and I read for an hour. And I've been doing it for 2 years, and knock on wood, but most nights of the month, I sleep solid for 8 to 10 hours. And it's not a sleep aid. That's the thing. I was like, Zyrtec is not it's not like a drowsy antihistamine. So I was very confused as to why it was working, but that histamine release that some people have in their brain in the middle of the night can wake them up. And so I love it. And it is truly a lifesaver for me because I've struggled with sleep since my early 20s, since the thyroid stuff. And so who knows, there might be something there.
Wow.
That is interesting. I know and you were talking about this, Nicole, for some people, it's that it's hard to get to sleep. For some people, it's hard to stay asleep or to get back to sleep when they wake up. I mean, I've always been the kind of person that wakes up in the middle of the night at least once, and I have to get back to sleep. And I've developed, my own systems for doing that. I use, and I'm curious to see if anyone else uses, I use the Calm app or Headspace to get to sleep. I listen to either a sleep story, and most of these stories, I don't know what the end is, because I don't make it there. But that means I can listen to them over and over again. And of course, I have my favorites. Or sometimes I just feel like either calming music or a soundscape or something like that. But in the middle of the night, if I wake up and I'm having a difficult time getting to sleep, I do a body scan. And for me, it's like a miracle. It's very it's just very effective it's somehow it allows, when you wake up and all of your muscles are just tense, it allows me to relax all the muscles and to just get into this zone. I don't know what it
Yeah.
is.
Great. And I think that again speaks to each of you had your own strategies and the thing that worked for you. I think that's a good thing. Unfortunately, the tricky part is it takes a little bit of time to unpack what works and to test it out for yourself. So every strategy you've recommended, I've heard of, other people have said it works for them. So this is great. I mean, that's the challenging thing. There's no like recipe. This is the one thing you do and you're all going to be okay, fine. I guess what I would say is one of the acronyms I tend to use with my patients is one that I just randomly made up that I call REST. So looking at the routine, the R in REST, and then the environment, which I heard you guys talk a number of things about. And then in REST, there's an S for stress and stress management and making sure that that's not interfering with your sleep in any way. And then the T is time for exercise, because of course I'm a physical therapist, so I have to say that. But yeah, those are the kind of big clusters I kind of look at. But there's also a lot around circadian rhythm as well, and working within the kind of rhythm that you have and the kind of your exposure to things like light and foods and stuff at different times of day that can make a big difference. So I guess when it comes to things like routine, I think, Tiffany, it was great to hear you say that you try to go to bed the same time and wake up the same times. That's one of the biggest cues that can hold your circadian rhythm over time. Our circadian rhythm, there's some evidence that it's a little bit longer than a 24-hour day. It might be around about 12 minutes longer than a normal day. So a lot of people, it starts to shift over time. So if you put someone like underground and they didn't have access to light, over time they would slowly shift a little bit. Because a 24-hour day isn't identical. Some people it's earlier, some people it's spot on 24 hours, some people a little bit later. So the light really helps to orient us. So getting outside time in the morning, like rise and shine, get out and have some outside time. Not everyone can do it with their jobs and their lives, but if you can get some natural daylight time, maybe even delaying wearing sunglasses for a period of time in the morning if it's not too bright to hurt, like you don't want to hurt your eyes, of course. But getting some of that natural light can really help that, like the blue lights that you see in the morning and the early daytime. And then at the end of the day, going into the environment side, I heard you talking about light. It really makes a huge difference for a lot of people. So an hour or two before bed, as you're making melatonin, your system is making it. One of the cues to make the melatonin is the time, like the circadian time. But another big cue is that the lights are changing. So you're getting more of those amber tones, those sunset tones. So reducing the amount of time on computers, iPads, any light at all. Some people recommend trying to go as low as like what's called 1 lumen. So like that's like one moonlight, like one full moon. So if your lighting is as little as 1 moon, like as if you were surrounded by just moonlight, and not having all of the regular lights on, that can really help a lot of people, that their system to create the melatonin as naturally as possible. But it's true, a lot of people will see their family doctors and naturopaths to look at options like melatonin or magnesium to help them, keep in that sleepy place. Yeah. Yeah. So there's a lot there, but the environment makes a really big difference. So for sure. So trying to get some, even half an hour in the morning of good sunlight time on your eyes, blue light, waking you up, getting your system going. And then at the end of the day, seeing a lot more. Like I even have a lamp that switches, so you can turn it 1, 2, and then 3, and it just changes. The light bulb just changes. So you can change the light bulb in your house. It can be as cheap as that for some people, or it can just be committing to not having email and computer time after a certain time of day, taking screens out of the bedroom. Those are all options that you can look at for that, for sure. And also not eating late at night. That's another. Sometimes stopping meals when the daylight kind of wanes off. So I guess a bit different times a day, but some people say you should maybe eating late at night also affects your circadian rhythm, and then the sort of the rhythm in your gut and the need to use the toilet and whatnot and everything can also help as well. So those are some other things you can do.
So all of this is, I mean, in a perfect world, we would like to check all those boxes off and every day have a controlled environment so that everything, but obviously life is not like that. And like you said, Nicole, 1 + 1 does not equal 2 in humans. And so there's still going to be challenges that come up, even though you know all of these things. So Tiffany, when you're working with all of the things that do work and there's still obstructions to executing them, how do you work with that?
I mean, so like if I'm having a bad day, I know we talked a little bit about the napping and whatnot. Like if I wake up and I'm having a bad day, obviously not on work days because I can't fit that into my schedule, but like if it's a weekend and I'm having a bad day, a nap does work for me. As long as it's not like super long. That way it doesn't interfere with my nighttime sleep. But I mean, that's one of the things that I'll do if, I've done everything and I'm just still having an awful day with sleep. And like I said, just using the tools that I normally do with the going to bed at the same time, waking up at the same time.
A routine.
Yeah, and exercise probably.
Yeah.
I heard you say that, Nicole. Is that something that that you consciously think about, Tiffany, if you're having a bad day? I know for me, if I and I don't do this specifically for sleep, but if I go on a hike, for example, then I know that I'll sleep better.
Mm-hmm. Yeah, like Nicole said, like getting outside. Like I will try taking a 15-minute break from work every day and getting out and just like walking around the block for 15 minutes. And then if it's like evening and the weather's nice, I'll get out for longer, maybe do like a half hour to 45 minutes. I do think that staying active does help with the sleeping at night. For me, I'm just with my kids being involved and everything and my busy schedule, I'm not always able to keep up with doing something like that. But in the past when it was just me and my one child, I would walk just like daily all the time. And I feel like I did help with the sleeping at night.
Yeah.
Well, it sounds like
I also,
your kids will keep you active.
Oh
yeah. And I also think ultimately, we talk about this a lot in the vestibular community, just not making a big deal out of it. If it is a bad day, just go, oh, it's a bad day, and I think that can help calm that nervousness about, oh my gosh, am I going to sleep again and have a sleepless night again tonight? And just surrendering and going, yep, it's a bad day. And just, going, oh well. I really think the psychological the conversation we have with ourselves around it is huge, because we can really get ourselves worked up.
Yeah, I would love to. I totally agree with you. I just completely validate that one. Without a doubt, it's that the head game is much as more, probably more important than everything else that you're doing, and trying to do the best thing day by day, but accepting it. So trying to work on things, but also making peace with and accepting that, this is the way it is. It's a really big deal.
Yeah.
I also wanted to go back, if I could, Tiffany, to the comment you made about the naps. Naps are fabulous. They're a wonderful tool. Some people are, of course, naturally, they can do it more easily than others. If people ask me for rules of thumb around naps, I try to say the 15-20-minute power nap is probably ideal, but less than 45 minutes is really what you want to aim for. That way you don't fall into too deep of a sleep. And trying to finish your nap 8 hours before bedtime, so you still have enough time to create that sleep debt to be able to sleep at night. And that sleep debt concept also really plays into what you were talking about before with the exercise. You guys all mentioned the role of exercise. Some people are a little more sensitive to not doing too much cardio or heavy intensity later in the evening. Some people do need to push heavier activities into the morning, but normally walking is pretty good for a day or a night. But yeah, without a doubt, you actually do create, when you actually exercise and you have outside time and you exercise, you actually create hormone changes within your system that actually do give you that sleepy feeling. And in fact, that's actually what coffee actually counteracts. So coffee actually counteracts. It's almost like a battery of sorts. So it's like you use it up as the day goes on. It gets bigger and bigger until you need to sleep. When you have coffee, it buffers it a little bit. So you don't feel how sleepy you really are. And then as the coffee wears off, you start to feel how tired you really are. So that sleep with exercise helps to drive sleep at night. And it also helps a little bit with your circadian rhythm as well. So yeah, I think those are, it's valid, just to validate why it works for you. And
Yeah, I think that's a really good point about the coffee and caffeine and the role it plays in sleep and waking. Some people they rely on it to wake up in the morning. It's interesting. My nephew used to have he could not get to sleep at the normal time. He was one of those people who stayed up halfway through the night, and that really, it messed with his interacting with people during the day. And then he realized, and he didn't drink coffee or any kind of caffeine, but he realized if he had caffeine at a certain time during the day, that gave him a boost that would then crash. He would crash at the time he was supposed to go to bed, and that helped him to regulate his sleep patterns. So it's just, again, different for every person. Nicole, I wanted to address sleep positions and how, are there specific sleep positions or bedtime routines you suggest to patients who experience dizziness at night or in the morning?
Yeah, that's a great question. Before we move on about the caffeine, that's such an interesting experience that one person had, your nephew, because the typical advice is, in a perfect world, is even to not even eat maybe in the first hour or so when you get up, and maybe just have water, or hot water can stave off the need for, like, I wake and need caffeine. And then oftentimes it's best to have your caffeine around an hour and a half to 2 hours after you wake up, and to definitely stop having it by midday for the average person. But just like you said, that doesn't work for him. It's just totally different. So you got to kind of go with who you are. So yeah, it's so interesting. So then the other one is about the sleep positions. Excellent question. There are some people with certain vestibular disorders who not just the benign paroxysmal positional vertigo or the BPPV, but also for, say, changes in the cerebellum, spinocerebellar atrophies, and other people that when they lie down, it actually brings on their symptoms. If anything, it gets worse with time when they lay down. So some people have to physically change the bed, adding pillows, canting the whole bed, or sleeping on their side, or putting a body pillow down to like keep them propped up onto one side. So there are some people who literally can't tolerate certain positions for long periods. Sometimes rehabilitation, graduated exposure, and addressing the emotional side of how stressful it is to go through this can actually, over time, can actually reduce your need for those strategies. A lot of physios will try, physical therapists will try to get you off of needing those strategies through rehab because it's not super functional. You can't prop the bed up when you go on vacation, or if you're visiting friends and family or other places. Maybe you can add a pillow, but maybe you can't change the structure of the bed, So we do try to work with people to see if they can rehabilitate through those over time, or whether that's something they have to accommodate at all times. Yeah, but yeah, that can make. And just getting a new bed, new pillow, swapping the mattress, you have to flip them every so often. Those kind of basic things can also make a difference. You're not also uncomfortable in the bed.
I can't tell you how many pillows I have been through to find just the right situation for me. And I wanted to kind of address this also. I have sleep apnea, and so I have a very specific routine that I use for sleep, and sleep position, which includes elevating my head and shoulders a little bit so that I'm not lying flat. And it is difficult when I'm traveling. I don't travel much, partly because of that and other things, but also having an L-shaped pillow that if I'm laying on my side, the L is hold on my back so I can be leaning against it, and also it goes between my legs if I'm on my side or underneath my knees. Having a pillow under your knees for me makes such a difference. That zero gravity position that they promote, I think really for me really contributes to being comfortable enough to be able to fall asleep. That it reminded me of, the connection between sleep apnea and vestibular disorders. I think I remember I've heard that there's been some research on that. Do you know about that, Nicole?
There's a very tenuous link. It doesn't seem like a really strong one. It might be that if there's a little bit of data that suggests that sleep apnea can also come about with stressful life events too. So I don't know about chicken and egg because a vestibular disorder, the type that really impacts every aspect of your life for months or years at a time, like you've described, Tiffany, that is a very stressful life event. So I don't know that there's always a deep connection. The other one is a lot of people don't know they have sleep apnea. So they trundle along for years with it. And when something else comes up, they go and get tested. They get the referral to the sleep studies, which are excellent, and they can identify for sure. So some people, I think, almost they get found out almost afterwards. So I don't know that it's a really clear correlation. I think it could be a number of different things kind of intersecting there. Yeah.
Interesting.
And with the pillows, by the way, just as an aside, sometimes those, the mother nursing pillows, those ones that have a bit of a round shape, those are like U-shaped kind of ones. Sometimes having that underneath a regular pillow can get you into a better sloped position so your neck isn't far forward. Or sometimes having, like it's a lot of pillows, but two pillows and then another pillow on top to make like a modified version of a slant can keep you in the lying position so you're not rolling quite as much naturally because you feel like a little bit of a barrier there overnight. And that can also sometimes help a little bit with that neck crank feeling of two pillows, just as an aside from a physical point of view.
I love the Casper pillow. That's my favorite. I don't know if you're familiar with that one, but that it has a core foamy thing, but then it has another layer outside of it that's more squishable. And so the two together, you can kind of pack it underneath your neck, and It's my favorite.
Yeah.
So, but there's just an infinite amount of information here, and I'm curious, Tiffany. I hope that you've learned some new things today, but you also have an arsenal that you've been using. Is there anything that you would go back to your younger self and say, and do differently, or suggest to her when she was struggling with sleeping early on?
Yeah, I would definitely say the going to bed at a regular time, about the same time every night. I mean, in my younger years, I was definitely staying up way past what was probably acceptable. Maybe getting like 6 hours of sleep and getting up and, doing my day. But I feel much better when I have had at least 8 hours of sleep.
Awesome.
Yeah.
I call it nursing home hours. Me and some of my other friends in the unfixed community were like, I keep nursing home hours. So don't expect me to stay out late. I like my nursing home hours.
Nicole, you mentioned when we were talking about sleep apnea, sleep specialists. So how do you collaborate with other providers like sleep specialists or mental health professionals in addressing things like anxiety that can hinder or prevent people from sleeping? How do you incorporate that into your healthcare?
Yeah, that's where the assessment tools can be helpful to look if it's more structural, like you were talking about with like, is it the pillows, the bed, the environment? We talked a little bit about that. Or is it maybe the stress side? Should they be seeking counseling and occupational therapists who also know a lot about planning and pacing and prioritizing your day and helping people to come up with maybe more structure and teaching them to self-manage in a different kind of way. So those are other healthcare providers who can be really helpful. Or does it cut that ring of something like a sleep apnea that they're not catching their breath overnight, or are they having like what looks like a medical disturbance overnight? Not just the kids have a fever, so I'm this is one bad night scenarios, like you were talking about, Tiffany, where you've got that on and off too, right? Like they've got the one-offs too, which can really affect you. But does it look like that could be the picture? Because that can help help. I think our role is to always help people navigate the medical system and see where they need support. But it hinges on kind of getting a bit of a picture on why, unpacking the root causes. Why are you not sleeping well? Which are the elements that you're struggling with? Because counselors can help with things like, strategies to let go, strategies for acceptance, how to use mindfulness, breathing techniques, body scans, which you brought up. They can talk about having worry time. So if you're worrying at 4 a.m, teaching you to worry 10 o'clock every day and let your nervous system start to orient. I have time to worry at 10 o'clock tomorrow morning, so I'm going to worry then, as opposed to worrying at 4 a.m. So it can kind of depend a little bit about, again, unfortunately, it's a little too personalized to give one suggestion. But I've heard from sleep clinic doctors that they get a referral in, and they often have to also re-navigate within the medical system. Often it isn't actually their domain, despite how much duress someone has with their sleep problems. It's often, like, for example, anxiety about not sleeping well. It's not that they're not just sleeping well. So yeah, that can be a challenge for too. And then the other piece is some people, they're shift workers, so they literally have, swings that they have to deal with, and they have to come up with, better strategies than the rest of us. Or maybe it's just, as you said, Tiffany said your younger self would have that. Sometimes we call it social jet lag, where someone just sleeps in till 11 o'clock Saturday and Sunday, and then gets up at 7 o'clock come Monday, and that's like a time zone change going across the country, about Canada or the US. So that can be is it more structural, or it can depend. Is that helpful?
Yeah, what you were saying when having worry time, that is definitely, I don't specifically do that, but I have had to, because I'm a light sleeper. So, and I dream a lot. And if I wake up in the middle of the night and I've just woken up from a dream, my brain wants to hold on to that and figure out, what was that dream about? And I've had to, and that wakes me up. So I've had to say, no, don't think about that. it's just, a pattern that, and it's become easier. No thinking in the middle of the night when I wake up. No thinking.
Well, and so that's an interesting thing, because some people do. They wake up and like, oh my goodness, I forgot to get for groceries tomorrow, and I don't have to get this for the kids and for the school project, and like you just oh, I can't forget this, and oh, I got that, and all of a sudden you're like, oh my god, it's been 45 minutes, I'm totally awake. You've almost missed that chance to kind of fall back asleep. You kind of have to wait for the next kind of round to come through. So finding ways to, like, if you are reading in bed, I know I have those midnight, like 4 a.m. moments too. I have like a red light, like a camping light, like so at least I'm not waking up I'm not stimulating myself by seeing. I find reading for a little bit kind of helps me get in that dozy place. But another strategy people could use is the idea where you think of a word like I don't know, friend, and then you start with F, and you think of a few words that are dissociated from each other that have to do with F. So it could be frog, and it could be French fries, and it could be whatever, just thinking of a few different words, and then you move on to R and thinking of, so you're kind of letting your mind do something, but then you're also not letting it go deep. So that might work. Relaxing your muscles might work. Breathing might work, and really feeling the breath coming in and out, true mindfulness, maybe that works. So, and listening to distracting sounds, music, apps, those are all great ways of letting the brain kind of stay in that relaxed place where it doesn't go deep into topics so that you can't fall back asleep. Yeah, so
kind of like counting sheep.
Yeah.
That's why they say count sheep. I love it. Sleep is so complicated.
We all do. So
I know, you'd think that over millions of years of evolution, we would have figured it out by now.
The world doesn't make it easy. We're expected to answer our phones and be on social media and like check things until late and always be available. And then, and so I think it's tricky. Some of us don't have friends and family to support us. So we're kind of doing a lot more like individually in our own homes. So I think for lots of reasons, there's a lot of pressure on us all. So yeah, I think, it's only been 150 years that we've had the light bulb to really extend our days. So try to get that natural light every day, rise and shine, get some sunshine, dimming everything at nighttime, trying to stay away from meals too late. Try to, imagine how you can kind of give yourself some nice routines and some regular exercise. At least those are the cornerstones. And from there, you can develop what other individual quirks work for you. That's what I would.
This has been fantastic. I've learned a lot. I hope everyone listening has learned a lot. What a wonderful conversation, and an important one about something that is so essential to being human, sleeping.
Thank you so much. We loved this conversation.
Yes, thank you so much for sharing your experience, Tiffany, and your expertise, Nicole.
Well, unfortunately, all the patients I've seen are the ones who've taught me through their experiences. So I thank them, and thank you for having us and letting us explore this topic together.
Thanks for tuning in to ICU this month.
We hope this conversation sparked new understanding of the vestibular journey. And for all of our patients out there, leaves you feeling just a little more heard and a little more seen. I see you.